Welcome, everyone, to another episode of the Attuning podcast. I'm your host, Liam Dalton. If you're new around here, why don't you consider subscribing or following the show if you're listening to the podcast version of this? And make sure to leave a review, a comment, maybe a rating. All great ways to help support the show. Sharing is obviously the best way because you get the word out, get it to a friend or family. All would be much appreciated. We have a fantastic guest on today, a really great mind, really amazing work. I've been looking into her work a little bit more recently, and yeah, I'm just really impressed with her approach, how she takes this, like how she takes how she looks in, and then how she really questions everything, and I have a strong feeling that she has a high amount of integrity, which I really appreciate. And so I think that is really helpful, especially in any sort of scientific type discussion, right? Or whether we're trying to get to the truth. I think that's really important because there's so much vested interest nowadays. And so I really feel like we're going to have a pure conversation here. And so, Robin, thank you so much for coming on. Thank you for your time.
Thank you so much. Yeah, and I checked out your podcast as well, and I think we are of similar mindset. So I really appreciate you being out there and speaking your truth as well.
Yeah, well, I appreciate that. So, the first question I ask all my guests is to get a little definition. I want to know how you define health. What does it look like? How does it manifest? You could really take this in any direction that you'd like. I just want to hear what you think. What is health?
I always like to go to the lowest common denominator, the simplest form. And so I believe health is when you're in harmony with your body systems.
Mm.
So everyone's harmony is going to be different. Everyone's nutritional needs is going to be different, but you have to know what your body's harmony is. And then when you start to venture out of that harmony, you get to know, you get signals immediately so that you readjust. Was it the oatmeal I was eating? Was that causing problems? Boom, you're back in before you get, diseases and illnesses stacking up.
Yeah, it sounds like there's this big component of sort of intuition or even just knowing yourself and knowing your body, being kind of in tune with not only being able to receive the signals, but being able to read them as well.
Right. And we're cut off from that from birth. We're not told to trust our body's intuition. We're supposed to go to the lab and give them our blood and have them tell us what's wrong with us. We're supposed to listen to the white coats with the stethoscopes telling us what to put in our body. If our body's healthy, we can't trust our own systems. And it starts even before we take our first breath. It's in utero. Your mother has to go get ultrasounds, which are so damaging to the fetus, to say that your baby's okay. Or even older women, you're supposed to get an amniocentesis to see if the DNA is okay. And it's all just, I think, designed to separate us from that God given intuition.
Hmm. Yeah, like it's prevalent now. Everyone thinks that they need a test to know if they're healthy. They need to know their blood chemistry and they need to know, their genetics and all of these nuanced things that, really the science isn't even there when you delve into it.
Right.
I think that's a really important point. Yeah.
Well, yeah, and it's not just when you delve into like DNA, because I thought, what's the marketing scheme? Oh, they cast spells on you. So on
Mhm.
23andMe, I made the horrible mistake when I was like 30 or 40. I can't remember when I signed up for it because I was adopted. So I was thinking I was going to find my birth father. It was the dumbest thing I've ever done. But I thought, why are these businesses so profitable? Blackstone bought Ancestry.com for 45 billion or something like that. Why? Is they can cast spells of death and disease on you because on 23andMe, I can't even close the account. I've tried to, but they tell me I'm predisposed to this disease. 20% more likely than the rest of the population to that illness, which has, and when you really delve into the whole science behind it, it's not reality based whatsoever. So they're just making it up.
Yeah, total unfalsifiable claims, but I think you make a really great point. Even forget about the science. You're being told that you're susceptible to all these diseases or that, you have a predisposition. And I think a spell is kind of the best way to encapsulate what's happening there, right? Because it's instilling fear and it's like a curse, right? It's like you're being, it's going to be in the back of your mind all the
Exactly.
time. Oh no, like I'm going to get breast cancer, skin
That's
cancer,
it.
whatever it takes it, you know what I mean? Like it's
That's
just
it. Well,
terrible.
and that's verifiable. So they made up this whole fantasy about BRAC1 and BRAC2 genes. And Angelina Jolie, everyone's favorite at the time, made the brave choice because she tested positive for both to have her breasts removed and reconstructed. Well, I mean, you can look at her now. There is no way that woman had her breasts removed and reconstructed. She made it
Right.
all up. But thousands of women had their breasts removed, healthy breasts, because of that.
Yeah.
And how many, hundreds of thousands got tested and now it's in their brain. Oh no, I could get breast cancer. You're saying it over and over and over, programming yourself.
hmm hmm And our minds are obviously extremely powerful, especially when it comes to healing and health and disease. You could certainly will your way to health and will your way to disease at the
Yeah,
same time, right? It's a double-edged sword.
it's the
We're very
belief.
powerful either way. Yeah.
Yeah, and that's what they work on. They work on your belief, that
Mhm.
knowing, I know. And this happened to my half sister. She knew because she was a smoker, couldn't quit. She knew she was going to get breast cancer. She just knew it. And so she went in and had, got tested and they said, you don't have anything. You have some benign tumor. She said, take them both off. I have breast cancer. And now she does.
Wow.
Hmm.
Amazing. Wow. Unbelievable.
That's the
It's a
belief.
common story too.
Oh, extremely common. And I still was working in home health and hospice. So I get to see the tail end of the medical industrial complex and
Mhm.
their tricks, smoke, mirrors, all of the things that they get everyone to believe in instead of coming back to that God given intuition and synergy within your own body.
Absolutely. Yeah. Yeah. I'd love to hear a little bit more about that because I think that's so unique. Yeah, you were sort of boots on the ground in the field seeing this stuff. You weren't working in a hospital environment. You say you did a lot of home stuff. I'd love to maybe just hear a little bit more about that and kind of some insights that came from that, right? Seeing that firsthand.
Well, the the most amazing thing I did was through home health because I couldn't work in a hospital. I'd get arrested probably that day. there's there's
Sure.
no way. And I couldn't administer drugs or shots or anything like that. So I've always worked in the home health sector. I started out in locked psychiatric wards, and I thought at that time it was the psychotropic medications that were horrible, that caused these horrible side effects. But in the more normal population, home health, we could actually do some good as a nurse. Well, boy, was I wrong. It's the same game. And so I just started looking at what the playbook is. But in hospice, I get to take patients who are at the end, the doctors, and they'll say you have less than 6 months to live. That's how you get a hospice designation. Well, that just basically means the medical industrial complex doesn't think they can get any more money out of you. They've they've gotten every last dime. So now you can go on hospice and take the hospice drugs, which is Haldol and morphine and lorazepam and a few others, and just sort of fade away. Well, I always ask the patient, hang on just one second. I've got to get my dog. She's whining. Come on. So on hospice, as the nurse, I get to put patients on medications or take them off. The patient gets to decide, but I always say, "Hey, are you ready to pass? Are you ready to transcend? Or do you want to see if there's something that we can do so that, you're not on hospice anymore?" Most people are ready to go. They're tired. Their body's given out. Some people are not, or their families are not. So what we'll do is we'll get them off all their drugs, including vitamins and supplements. No titration schedule, just boom, stop taking them. And then I'll have them do like a little quarter teaspoon of baking soda underneath the tongue because a lot of people aren't really willing to change their diets. And if they have like different issues within the body, like severe edema or lymphedema, where the scales in their legs are the size of tree trunks and look like tree trunks. Well, I have seen people coming in with end stage cancer, leaving with no longer having cancer just from doing those simple things. We stop the root cause of whatever was toxifying their body and poisoning it. And if it's not damaged past the point of no return, I've seen several miraculous healings, if you want to call them that.
That's amazing. Wow. And so back, you worked in a psychiatric hospital initially, right? How long did you do that? That's so interesting as well.
Like a decade. So I was in
Oh, wow.
mental health for over a decade, and in the Lock Psychiatric Hospital, my job, was as a case manager was to get people into their own homes. So we're talking, people that have severe schizophrenia, maybe had some criminal background, and you're supposed to get them on, voluntarily taking their meds. Most people don't want to take those drugs because they're just horrific side effects. So you're supposed to force them to take their meds and then get them to move out. Well, I didn't like forcing anyone to take the meds because I thought, well, I wouldn't want to take them either. But we would kind of look to see, like, can you, get up to baseline like a normal human being and live outside in the community? And a lot of times it was yes. Like, I wouldn't treat them any differently than I would say have a conversation with you or anyone else I just met. I would hold them to a higher standard, and a lot of them rose to that standard.
Absolutely, yeah, and I'm thinking back, we had a discussion with Mr. Robert Whitaker. He brought up the Quakers back in the day, and it was all about like dealing with the extremes of mental illness, and it was all about treating them with, you know, like anyone else, right? Like treating them like an insane person is like a self-fulfilling prophecy in a way. Often, there's a lot of really interesting accounts of people developing, psychoses or schizophrenia because they've just been treated this way their whole life. Um, and to tie it into our the start of our discussion there, in the book How to Become a Schizophrenic, there was this really um, interesting dialogue around um, having an aunt or a relative that had psychosis, and because there was somebody who was psychotic in the family, then if somebody was off, like a child was off, they would say, "Oh, it could be familial or it could be genetic," right? And then they would say, "You might end up being insane like an aunt." And I think that was one of the criteria that Modrow pointed out in that book, How to Become a Schizophrenia, was it was like a criteria that having someone in the family
Mhm.
created this environment to be able to justify treating like a young one like they're insane or something like that. And then it's just a self-fulfilling prophecy. So I think that's kind of an interesting point on casting a spell, as we were talking about earlier. And yeah, so I'm really curious on your thoughts on these, more severe types of mental illness, like schizophrenia, psychosis, stuff like that. What were some of the things, treating them like normal people and really like treating them with a high degree of respect like everyone else, that was probably a huge part of the healing aspect. Was there anything else that you kind of found to be helpful in the healing journey there? Even we could maybe tie this into, what do you think the causes are of these severe mental illnesses?
Well, and I saw thousands of different people throughout that 10 years. And the common denominator was usually like an event, usually around adolescence. So whether the hormones triggered it, but there was usually, some type of severe trauma, but I couldn't see that it was any different from anyone else's. So I think it's difficult to say, okay, it was because of that. Um, the vaccines, are they dormant for a period of time? Do they get activated with the hormones in adolescence? I don't know. Was it a combination? Like with mercury, I looked up how toxic is mercury and like Mad Hatter disease, where they would wear the hats and the mercury was there because they would shape the hats. But the guys making the hats would dip their bare hands in the mercury for years without getting mercury poisoning. Eventually, of course, they would, but it took a long time going straight into the mercury. So, what is it that's causing that? Is it extreme stress in the household? I mean, I think that yes, we are resilient as humans, but each one of us has a breaking point, and it's different for everyone. So you can traumatize a child up to a point, and then they break. And is that breaking point because of all of the other factors? Mercury poisoning, vaccines. I think it is a lot of it. I saw one patient who was at a locked psychiatric hospital and he had no fingers because his mom had put his hands into a blender. Probably not a, a child that would have developed schizophrenia, but he developed severe schizophrenia. But again, it was that breaking point. Your mother, the woman that's supposed to nurture you and keep you safe, is the opposite. you know and the medical establishment would say that would not be possible because you can't give someone schizophrenia. Or at the time, I would argue with a psychiatrist that I don't think this is because of a dopamine issue or a serotonin issue. I think he was traumatized and maybe he would benefit from different modalities. But no, of course, it was just drugs, drugs, drugs. And
Yeah.
it's just chemical restraints. You're not actually helping anyone.
Mhm. I think another interesting aspect of it is like, because there is this interesting connection to traumatic events. And, I think that there's likely this complex interplay between toxicity and our traumatic events, or even not living in alignment with nature and not having the capacity to be able to process these events as they come, right? Because it's not like this was seen in tribal settings for the most part, right? And so they were living, a natural lifestyle free of toxicity largely. And um, but I wonder, because this initial sort of psychosis, the psychotic event, right? I wonder if like allowing that to manifest has something to do with the healing process, because I'm thinking back to my conversations on these topics and the book How to Become a Schizophrenic, great book. You know, Oftentimes when they're not given these psychotropic drugs, which just exacerbate the issue and allow it to continue cyclically over and over and over again, because you can never get off of them,
Yeah.
because they actually create schizophrenia or psychosis. um, you know, I wonder if allowing that to manifest, like the event to manifest, because you're obviously dealing with, oftentimes, if it is trauma related, you're dealing with this distorted reality.
Right.
And so then your brain becomes like, obviously it becomes distorted. And maybe that manifestation of that has something to do with the healing process, right? As you're mentioning, the mother who's supposed to be the nurturing figure in the child's life is putting your hands in a blender, right? That is distorted of what is true and what is natural. So, any thoughts on that?
Well, I mean, it's each one of us has this manifestation of symptoms. And so I think as a society, we're obsessed with the diagnostic code. Like we've been, brainwashed into thinking it's schizophrenia instead of what exactly are the symptoms. I had a lot of young men. They seemed older men at the time. They were in their like late 20s and 30s that told me the CIA implanted a brain chip in their brain. And ever since then, they heard voices. And these were highly successful men. Some were worked at Boeing. This is up in Bellingham, Washington. Some worked at Boeing. Some worked in, high level government jobs. How do I know the government did not implant a brain chip, especially now? At the time, I thought, maybe, maybe. But it pushes you to the point, to kind of think, well, the government experimented with LSD. MK Ultra programming experiments with LSD. Like you are working towards, splitting people's minds. Like Britney Spears is a prime example. You can see like she has split personalities. They do that in MK Ultra programming. I interviewed Juliet Engel for she was in the sex magic program with the government, and those books that she wrote, Angels Over Moscow, and there was another one, I can't think of it off the top of my head, but talks about how they go about splitting the mind. I don't, so I think some people were implanted with brain chips. I think some people, like that patient with the hands, was his mind was split with the trauma. We all have this electrical system. Like you can fry your electrical system in your brain too with severe trauma, or I don't know about the whole adrenochrome, if it's real or not, but the science is real. Like you can scare someone so much, especially a child, knowing they're going to die, they will release that specific adrenaline.
Wow. Yeah. Yeah, you can't put it past the government, honestly.
None of it. Like
Yeah.
I don't put it past any of it. And I think like German new medicine always wants to find it was a shock, and then that's it. And other modalities, it's like, no, it was this. You have parasites, or no, it's this. I don't think we can ever just reduce it down to the one thing, because we are, how many different experiences have we had up until that point? And to say that you figured out which ones they were, I think is impossible. But then I just look at, kind of what were the symptoms that started manifesting, and then let's back up. Before that, what was going on? Can we meddle around in that 6 to 10 weeks prior to the symptoms manifesting, and see if there was something that changed, that we can go back to, how you were operating before that. Maybe get rid of certain toxins and poisons.
Yeah. Yeah, well put. Yeah, that kinda ties into a couple of the other topics I wanted to touch on, the role of trauma in disease. Really curious about your thoughts on this, when it comes to things like chronic illness or cancers or stuff like that. I'm really curious about your thoughts on if trauma has a role in the development of these diseases. Is it, case by case? Just love to hear some thoughts on that.
Well, I think we have gotten obsessed with trauma and
Yeah.
being like a victim, like wearing the heavy victim medallion. It's like, well, Leah, I can't really show up in my potential because did you see my long laundry list of traumas? Because, there's no way I'm going to show up and do my best because I'm traumatized. And then, they call it like peeling back the layers of the onion. And I don't like that, because then what are you left with? Nothing. Everyone was traumatized. But what did we make it mean? What did we believe about that? I mean, I've suffered significant trauma. You can read my old stories like the rifle and certain things, and you would think, well, and even my birth story was insane. But you can think, all right, well, that's going to push me under, and I'm going to develop diseases, and I got to be really careful with my psyche and my this whole, chemical biology. But yet I can believe it was the thing that's allowing me to be more intelligent, more empathetic, more understanding. It's helped me to reach my potential. I suppose the same circumstances, but what did I make it mean? So I think there's a heavy reliance on trauma, shock, whatever, causing disease. Of course, it is part of it. If you're consuming vitamins and supplements and going to Jack in the Box and drinking alcohol and waking up in the morning with a cup of coffee, But no, it's the trauma that happened when you were 6 years old.
Yeah, sometimes it can kind of be, a way to off put the responsibility of taking care of your environment
Yes.
and feeding yourself a diet that's not deficient in anything.
Well, and that's the same thing that I think, because I got an award when I left Washington from the psychiatrist, because the patients on my caseload did significantly better. But I did
Uh,
not put the extra work into it. I didn't follow anything. We were supposed to put them on a point system and do these punitive things. I just treated them like an adult. We had conversations, adult to adult, and I said, I you deserve to live better. Like, you're selling yourself short. I see potential in you. And if you don't see it, I'm not going to be a constant cheerleader, but here's your options. Here's your opportunities.
yeah, and that's kind of like the opposite message that's what's being given when it's all being reduced to trauma, right? Like you're traumatized and you're broken
Yeah.
and you're
Let's talk more
yeah,
about that.
yeah, interesting. Interesting. So I do I practice psychotherapy and I do EMDR, eye movement desensitization reprocessing. I think it's such an interesting modality because based on what you're saying too, it's kind of how you internalize things. So I don't necessarily work with traumatic events per se, but I work with the associated self beliefs, right? And because I'm really concerned with sort of the mental health component of it, right? I'm not claiming to cure any physical ailments through trauma processing, but these associated self-esteem issues, anxieties, different things like that can really be tied to these negative self beliefs, right? And so
Yes.
that is what I like. I aim to break down the negative ones, build up positive ones, but it's all, we say trauma and we kind of mean what we mean by that is like negative life experience,
Right.
but then that leaves the other side of the coin where there's positive life experiences. And, it's all about how you interpret it at the same time, because if you internalize it, it can be very negative. Even a positive experience that somebody might think is positive, you can internalize it as negative. And so it becomes very subjective because at the end of the day, the experiences that we face are there is no good or bad or whatever. These are all human inputs, right? Nature just is what it is. These experiences just are. We can attribute our own morality onto it and try to really project onto our experiences. But yeah, so I think you're really working within kind of like that subjective part of things there
Yeah.
too.
And that's where we're taught to live. We're taught to live in that subjective experience, and that's what is forming us when the opposite is true. So
Mm,
we could be so much more resilient if we're taught, this was an event. Now you have to go within yourself and create, if you want to be the hero of that story, create yourself as the hero. And
yeah,
because, animals can't carry on, the story like on their backs and carry, all this weight around. They have trauma. They witness their children getting, eaten by a lion. Okay. And then they shake it out and they go on living. They don't develop a drug addiction and alcoholism and like, well, I saw my child get killed and really it's not my fault. I drink a bottle of wine a night.
it's a great way to put it, honestly. That's hilarious. But yeah, when it comes to that, I think you're you're absolutely right. And like it might not, I know you're using comedy here a little bit, but like the animals don't just lay down in a cave and just willow away and die. Like they continue on.
Yes.
Like obviously they're not going to reach for a bottle of wine, realistically speaking, but they could very well lay down and never get up again. Like so, like you're highlighting a great point here, and I really appreciate that. But that's true. It's true. They shake it off. I think that's another big thing. It's really funny. Like I learned that from my dog. Every time even when he gets a physical trauma, right? Like he gets hit in the head by a lot. Like when he runs into a tree or something. He's a silly dog, right?
Yeah.
He walks away, he shakes it off, and he's on to the next thing, you know,
Yeah.
and he'll go and do it again. You know, he might learn. He learns slow. I think he learns a little slow, but he does learn eventually. But every time something happens, he shakes it off and he moves on, you know. So that's something that you could do. You could shake it off. You know what I mean? Like you could
You
shake
can
off
shake
something
it
bad
off.
happens to you, shake it off.
Yeah, and
Yeah.
I think the game changer is when you realize, like, no matter what life throws at you, you're gonna get back up. It might take a couple of
Mhm.
days, you might need to wallow in your, self-pity for a minute or 2, but you're gonna get back up.
Yeah. Yeah. Yeah, that empowerment piece is big, right? And I think this kind of ties into the role of like even higher power in health and wellness, you know, having that faith that you have that ability, right? That is in you, that you are resilient. You know, we
Yeah,
are very resilient,
we
you know.
are, truly.
Yeah. Go ahead,
Well,
please.
I was just gonna say, like, that I really like what you said about, having that faith. You have the faith the sun is gonna come up in the morning, the same faith that you have, like, you are going to persevere, you are going to get out of this depression that you're in or the anxiety, you'll figure it out. Keep
Mhm.
going. Yes, that didn't work, that didn't work, that didn't work, that didn't work. It's just pushing you to the one that one thing that does work, and that's where we can maybe train more about resilience than victim.
Yeah, absolutely. Yeah, I think that's a really important message, and I don't think human beings, you know, since we are these beings that can carry a story with us, we can carry this weight and these, you know, it is built within us, right? But I don't think that a human being can live without faith, you know, like the atheist delusion in a way. I think that people think that they're atheist because they're like, oh, I believe in science, but that's the faith.
It's the same, right?
Science is
The
the
religion
biggest
is what?
religion out there, right? You have faith
Gravity.
that the sun comes up in the morning, not because of, you know, the beautiful divine, but you have faith because science has proven it so. You know, it's the same thing, it's just a different story, but you still have faith. But the problem with when you have faith in science, science is filled with half truths and all of this
Manipulation.
nonsense and these death stories. You know, it's on the death cycle of things. Everything's leading to disease and dismay, and you know, whereas when it comes to believe and have faith in like higher power of some sort, you know, it's all about beauty and love and light and life. You know, so
Yes,
there's big
and
discrepancy there.
that's it, that's the difference. You have faith of the sunlight as the same as you have faith that someone has your back and your healing is there,
Yeah.
you'll get through it. You'll get through it in a beautiful, synergistic, harmonious way, and I agree
Mhm.
with you, like, we can't live without that. We can't live without, I mean, people call it the universe, I call it God. I had an experience with God when I was 3. Let me close that door. It's got the
Sure.
leaf blower. Okay. But I had an experience. Oh, sorry.
Go ahead, please.
Um, with God when I was 3. And, I had wandered away from our campsite in the middle of nowhere and was gone the whole day. And of course, my parents were worried sick. And then when I came back, I was shocked that everyone was so worried. I'd only been gone a few minutes, but it had been the entire day. I'd been in a clearing, I'd seen this light, I understood things, not like I was the special chosen one, but the message was that we're all the special chosen ones. We don't need the religion as our stepstone to understanding. We go within and we trust that and we listen to the voice of God through us.
Wow. Yeah, I mean, that's a really powerful experience. I wonder, you know, what would you say to someone who hasn't had that experience, you know, as kind of the proof in a way? I'm just curious what your thoughts are on like how to even begin going within and finding this
Mhm.
power, right? Because I feel like people are longing for it, and I feel like a lot of people don't realize it. Not that they don't have it, because like you
Yeah.
said, everybody is the chosen one. We all have this, right? But some
And
people might not feel like that.
yeah. Number 1, stop seeking it. Number
Sure.
2 is get rid of any impediments. Alcohol, caffeine, nicotine, cannabis. prescription drugs, vitamins, supplements, packaged foods, anything with HEK 293 cell line in it, get rid of all of that so that you can hear, and then you have to get silent. Now, I think people are so freaking out about how fast time is going because when you're not engaged with someone, you're scrolling on your phone. And that's a time eraser. So you have to get rid of all of those distractions and then get quiet long enough to hear. So that might be a 4-hour hike. That might be, turning off the radio and everything else when you're driving, which is what I do. I drive around, to home health patients with no radio on so I can hear. And it takes, it takes a long time. I think it takes a long time of that silence before you can then hear something come through you.
That's absolutely beautiful, and that's something that I feel like that's what everyone lacks. That silence.
Yeah.
We're
And it's
constantly
simple.
engaged in something.
We're constantly engaged in something that is focusing our attention for a few seconds at a time. We were
Yeah.
all just commenting, a few years ago how we're all goldfish brains. And now it keeps getting shorter and shorter and shorter, our attention span. And that's, I think, by design. You're so much easier to rule over as a slave population that we are when you are distracted.
Mhm.
You
Yeah,
can,
it's so multifaceted.
yeah,
Because it's not only are we easy to rule over, we're also really easy to make money off of, and really
exactly.
easy to just keep docile. Yeah, it's just like so multifaceted.
That's what, like, the Egyptians, they gave the slaves beer on the weekends, and that kept them in the cycle. So they were better slaves when they gave them beer on the weekend. Well, now they figured out, why would you just give away the beer? Get the slaves to buy their own beer with all the money they made during the week. Like, they're clever because they're working backwards. I don't think they're that
It's
smart, but,
clever.
I think this is how they operate
Yeah. And I mean, I think if you look at history too, you'll see that they've operated in the same manner for the most part
the whole time.
the whole time, right? It's like they have one playbook.
That's
It's
it.
Machiavellian. It's all this. It's terrible, but they use it over and over and over again,
'Cause it works.
and it works. It's been working, and they just change the words, right? Like even with the whole germ theory thing, it's all the same. They just change the name of the virus, or they change the name of the germ, or they change the name of whatever. Like,
It's the
and it
new
just keeps working.
scary one. Yeah. Yeah,
Yeah,
this one's the scary one. Or
yeah, exactly.
this is the miracle cure. Not the last ones. We admit, okay,
Yeah,
they were poisoned, but no, this is the one. And
yeah,
everyone
yeah.
falls for it. I'm shocked every time. Like, people still ask me about, well, what about this drug? Or what about like, no, it's still a toxic poison to your body. You can't poison the body back to health.
Let's talk about that. Vitamins, supplements, medicines, tinctures, all of these great things that are being sold to us constantly on our Instagram
Yeah.
feeds. What's the problem with them?
So here's what I have narrowed it down to. You hide God. You hide the miraculous capacity of your body to heal itself with nothing, because I don't have a control. I don't have the Robin 2.0 that didn't take the miracle cure and got better. I just usually, when we're ready to take that tincture or that vitamin or that supplement, I have changed my life up until that point. I've stopped eating junk food. I stopped going to Starbucks. I quit drinking alcohol. But then I'm going to take this, elixir, and I'm going to say that healed me instead of my body healed itself. So I think we're always seeking that external. If
Hmm.
you look at vitamins, I started out looking at vitamin D3 because my son broke his shoulder from a short fall, like a little old lady. I mean, the shoulder break was severe. I actually gasped when I saw the X-ray, and I wouldn't let him X-ray it for a few weeks because I didn't want X-rays going into a fresh break and right into the bone. My brother actually got bone cancer that way, but I thought it was just isolated. Vitamin D3 is rat poison. It pulls calcium from the bones. That's probably why what happened to him. I started researching all vitamins and supplements. Well, they're made in the identical way that you make a prescription. Like if you're going to get, digoxin from foxglove, it's not like you put the foxglove plant into a machine and it extracts out the active ingredient of foxglove and you get digoxin. It's we pick one compound out of digoxin out of the 500,000 and we make a chemical copy. Same thing with vitamin D3, same thing with vitamin B1, thiamine. You pick one compound out of bran, you make a chemical copy out of coal tar, ammonia, acetone, hydrochloric acid, and other chemicals. So we're not chemically deficient. We're love deficient, we're nutrient deficient, but all of those can be accumulated no matter where you are at any time. I've seen that. I believe that is true. But
Yeah.
we want the savior. We want RFK Jr. is going to save us. Trump's going to save us. Whoever it is, they want the savior. And so I think I trigger people so much because I take away their binky of their miracle cure and I take away their savior. And it's like, no, you got to do the work.
Wow. Yeah. Probably the most meaningful thing you can do, though.
It is. And that's real love, I think.
Absolutely.
Telling someone the truth as you see it, take it or leave it. Like, I want to show you there's a question to ask and a choice to make. Please make an informed one. I will love you either way. I don't
Sure.
care if you still want to take the vitamins, but hear what I have to say that's not paid. I'm not paid to say anything. I don't get any money if you go buy Brussels sprouts instead of, you know, taking a vitamin B12, but just at
Sure.
least hear another side of the equation. And if you still choose, that's great. Now I can rest at night because I know that you have all of the information, or at least,
Mhm.
as much as we can get in this insane world where we can't actually get too much information.
Sure. Yeah. In the age of information, we all know nothing. Um,
Exactly.
I'm curious, can we kind of differentiate supplements? Like, what if you think bee pollen is a supplement? Like, I kind of think about these things a little differently, right? I think you're really referring to like the petrochemical derived
Chemically made
supplements, right? Stuff like that.
supplements. Like supplements, I'm not referring to and would never as something that is from the God given world. So something that you get out of your beehive or an herb, but they still need to be treated with just as much respect as anything
Mhm.
else. You can't just, go into the forest and start chewing on leaves. Like everything has an energy and a frequency, and you have to really know and be able to communicate with plants on their level.
Yeah. Yeah, you need to be attuned with your environment, right? With
Yes,
what's around you, right? And that's a lost art too.
it is. Well, and I have the fortune of growing up in the middle of nowhere, Nevada, where we were not allowed to be inside the house if the sun was out. Rain or
Yeah.
shine, doesn't matter what temperature it was, which I loved. And so we were free to wander wherever we wanted to wander. And I would communicate with the plants. The mountains would tell me bedtime stories. And I didn't know everyone else didn't hear that. So I went into school and I had this particularly great story I wanted to tell my friends. The mountains had told me last night. And so I said, I was, trying to like get the conversation going. So I'm like, well, what do the mountains tell you when they put you to bed? And like, what are you talking about? You're insane. And I was so disappointed. I was like, I can't share my story. I was like thinking, okay, they're going to really get excited about this bedtime story the mountains told me. And that kind of shut it all down. I was like, well, and if I'm going to have friends, I can't actually be myself anymore. So
Wow. So what did the mountains tell you as a
it,
bedtime story? Do you remember? I'm so curious.
well, and there was two mountains behind where my bedroom was. And
Yeah.
so I called them the grandfathers. Then the grandfathers would tell me like how it was specific what I had done that day. Like you were really good talking to your teacher. I know you were nervous, but you did such a good job. We're so proud of you. Just things like that. Just really simple, 4 or 5-year-old compliments. And I
Yeah.
just loved it because my parents were not, you know, the nicest, and,
Sure.
and so I was seeking that unconditional love. I got
Wow.
it. I got that
Wow.
medicine all around me.
Hmm. Yeah. I think that speaks to the power of the silence too, right? You weren't going to bed as a 5-year-old with an iPad.
Exactly. Yeah.
Yeah.
Nothing, no distractions in the room. I mean, the
Mhm.
TV that we grew up with, it had 3 channels and it was black and white.
Yeah,
There's nothing on anyway, but
exactly.
of course, we watched it.
Sure. Yeah. Well, I think this might be a great time to wrap things up on that beautiful little story there at the end. I really appreciate you sharing that. Do you have anything that you want to add to this episode? Any final thoughts? Anything that you might have missed? Now would be the time to share.
The one thing I like to leave everyone is, like, my tagline, "You are the medicine." Like, you don't need anything external for the most part. You correct where you are out of harmony, and the body will heal itself. But again, that's not a $1,000,000,000,000 industry.
Yeah, you're not gonna make, too much money telling people that, right?
No. No, but it's
But
but it's like I went everyone wants to ask me, "What do I eat in the morning?" Well, you're not my clone, so don't eat what I'm eating.
sure.
I want, like, look to yourself. You are so wise. You are so powerful. Listen to the voice from within. Start to like link back up with your intuition.
Yeah, that's great. Yeah, spend some time in silence. I love that.
Yes.
So, how can the listener learn more about your beautiful message? How can they support you? Where can they find you?
I just go to my website, purifywithin.com. I have a nice little group over on Telegram. You can join there. It's not for debate. We're not in there arguing back and forth. It's just, hey, I have symptoms of a rash. What do you guys think? And everyone kind of chimes in. Well, what happened, when you started the rash? So that's kind of our little how do we actually heal? Because we're done debating over distracting ourselves with this and that. It's what are we
Cool.
capable of if we're not poisoned in any way? And let's start to have the conversation around that. So that's you can go to Purify Within and click on the Telegram group link. I teach classes several times a year, so you're more than welcome to join my classes. I just started an 11-week course to help people get all of the toxins out of their home so that you can eat your laundry soap if you wanted to, not that it's tasty. You can eat your dishwasher soap because you're eating it anyway if you're using it. So, how to get rid of all the toxins and make all of the products for pennies on the dollar. So you're going to save at least $1,500 the first year if you do all the homemade recipes.
That's so cool. That sounds amazing.
Yeah.
Awesome. Yeah, we'll put all the links down below for everyone too, and make it nice and easy for you guys to access her and her amazing work. So, Robin, thank you so much for your time today. I really appreciate you coming on and sharing some of your message with us.
Thank you so much for having me. You are a delight.
Thank you. I want to thank you all for listening. Of course, you should all know that this is not medical or psychotherapeutic or any sort of advice. This is for your informational purposes only. But also remember that we're all responsible, sovereign beings capable of thinking, criticizing, and understanding absolutely anything. We, the people in the greater force, are together self healers, self governable, self teachers, and so much more. Make sure to reach out if you have any questions, criticisms, comments, concerns. You know where to find me: Instagram, email, YouTube comments, whatever. I'll get back to you at some point. Really appreciate you guys sharing your thoughts on the episodes. Really eager to hear what you guys think about this one. And if you did like this, make sure you give us a like, share, comment, follow, subscribe, review, rating, whatever you got to do on the platform you're on. Help us grow, help get the word out. Be much appreciated. Just remember, there are two types of people in the world: those believe they can, those believe they can't, and they are both correct. Thanks for listening, guys. Take care.